Good morning. My name is Erica Bland-Durosinmi, and I'm Executive Vice President of SEIU Healthcare, Illinois and Indiana. Thank you for allowing me to testify today, Chairwoman Moeller and members of the committee. SEIU Healthcare represents 85,000 workers across the state, including home care, child care, nursing home, and hospital workers. We bring a unique perspective to conversations about long-term care, representing thousands of nursing home workers and thousands of home care workers. And for the last 15 months, our members have been on the front lines during the pandemic, continuing to provide care and assistance to seniors and people with disabilities, despite the risk. For years, we have fought to ensure that our members on the front lines of long-term care be treated with dignity and respect. This has meant everything from fighting for better staffing in nursing homes to making sure that home care workers are compensated fairly. But it also means changing the way that we as a state provide these services. You'll hear from Anita in a few minutes, one of our nursing home members, about conditions in nursing homes and how low pay and low staffing impact the care in nursing homes. I'm going to focus on what we need to do to make long-term care system work better for residents, consumers, and workers. We believe strongly that we need to rebalance our long-term care system so that we are able to prioritize home and community-based services to the greatest extent possible. For too long, our state has relied on institutional settings, such as nursing homes, to meet the needs of seniors and people with disabilities. This needs to change. Some may ask why SEIU cares. We have members across the long-term care spectrum. We could just advocate for better wages and benefits, but we know the status quo is not working. It's not working for our members, nor is it working for nursing home residents. We know that there is no magic solution here, but we must take a comprehensive look at how to fix the system. And this must include, but is also broader than, moving more people into home and community-based services. We need to look at expanding home and community-based services so that the state is offering the wide array of services needed where they are needed and for all who need them. We need to look at long-term care eligibility. We need to look at affordable housing, making sure that housing and both affordable and accessible, or are both affordable and accessible for people with disabilities and seniors. We need to look at our healthcare system. Where are specialists available? Where is transportation available? If we can start to shift the emphasis of our long-term care system from nursing homes to home and community-based services, we can make sure that people with disabilities and seniors can receive care in the least restrictive settings. We can provide better care in both nursing homes and community settings. We can make better investments in our workforce, and we can save the state money. This last year has taught us a lot. We've seen that the deadliest place to be in the last year has been a nursing home. We saw just last week that from HFS, many nursing homes have horrific racial disparities in how they treat and care for residents. We know that nursing homes continue to not staff appropriately. This is unacceptable, and we are committed to figuring out how to do this differently. Thank you for your time today.